In October 2023, the House of Representatives called for a state of emergency to be declared in the health sector. In November 2023, the Coordinating Minister for Health and Social Welfare, Mohammed Ali Pate, declared a state of emergency in the health sector at the 64th National Council on Health that was held in Ekiti State. Myriad issues facing the Nigerian health sector, including a shortage of qualified personnel, medical equipment, medicines, among others.
Now, in a recent development, the Nigerian Center for Disease Control and Prevention announced an outbreak of cholera across a few states in the country. The Lagos State government has confirmed 350 suspected cases of cholera in 29 wards across some local government areas of the state, with 17 confirmed cases and 15 fatalities so far. Joining us to discuss the health sector is Director General, West African Institute of Public Health, Dr. Francis Ohanyido. Good morning and thanks for joining us.
Yeah, good morning. Thank you very much. It's a pleasure to be here again.
All right. There's, arguments that, when you hear of a situation of or cholera outbreak, rather, in certain places, it really just paints a picture of the state of healthcare in that region, the state of the most basic form of healthcare infrastructure, and also, just the most basic sense of living in a clean society. Does this really tell where Nigeria is? Before we get into healthcare proper discussion, but does this tell where Nigeria is with regards the most basic requirements for a clean society?
Okay, thank you very much. I think you started on the right note. I think when I joined on the call, I overheard somebody talking about how much government or people prioritize or how much the life of people are prioritizing the security, in the sense of security. And
yes.
Let me tell you that what we're dealing with here is also around health security. So it falls into the larger realm of security. So, and I also agree with you. The prioritization of people's lives is not where it should be in Nigeria. There's still a lot of inequity. And back to your question, cholera is actually considered a disease of poverty, which affects people with inadequate sources of water, lack of safe water, and basic sanitation. So when you have these two major conditions, you have a recipe for a cholera outbreak, and especially in endemic areas, so you have that chance that cholera might be. So yes, you're right. So cholera may be actually a signal of the level of squalor that we have currently in Nigeria. So what we're seeing is an issue that is precipitated by the sense of lack of the basic infrastructure that Nigerians should ordinarily have for health and for sanitation management around their immediate environment. So when we see all these things happening in the southern part of Nigeria, especially south, southeast, look at those states, you'll still find that a large chunk of this problem is because they don't have potable water. You still have a squalid environment, rapid urbanization in certain areas, because in those areas particularly you don't have conflict, unless you are talking about places like Zamfara and some parts of the northeast if you have cholera there. So, but in this case, it's more of rapid urbanization and inability of government to provide those basic infrastructure, especially water, potable water, for people to be able to, Nigerians is Nigerian household is the government on its own, so you don't even know where they get their water sources anymore. So some of them have, if they can afford it, have boreholes, and most others just basically look for people to other sources of water, whether stream or anything. So it's true. It's actually a major problem for Nigeria.
All right. If we look at, we've had several cholera outbreaks ever since the first outbreak in the 1970s. What would we say? Do we have any idea if there was any direct cause for the recent outbreak? And yes, you're right regarding the challenges that we have and how cholera reflects the state of our society. But do we have any pointer as to if there was a direct cause in this particular outbreak?
Okay, so it's very difficult to attribute any direct cause to cholera in this setting now, because there are two basic types of cholera, the 01 and 0139, and these two types have been moving around the world since 1961 from the Delta region of India, the Ganges River in India. So But over time, it has become endemic in a lot of countries, especially in countries where you have squalid environment, and some of the low and middle income countries. So what you've had are three major drivers of this. One of them is like I mentioned, conflicts is one. Second driver is rapid urbanization and poor planning of cities. And then the third one is actually basically the issue of climate change. So these three elements have now begun to come together and to be able to haunt us in one form or the other. And in our own case in Nigeria, we already have cholera as an endemic thing. And there are people who also have it, they are carriers, or rather who have it, but don't manifest it when it happens with them. So what we're seeing now is probably that there are active cases coming up. So we're now talking about like a sort of epidemic within a particular area for this season, and all that. So that's what happens. So if now it begins to spread within certain clusters like that, then you now start talking about an upsurge of cholera, but ordinarily cholera is without because it's already an endemic condition in a lot of countries around the world. And like I said, major drivers are three, which are conflict. Second one is rapid unplanned urbanization, and the third one is climate change. And the more climate change factors afflict mankind, the face of climate change is really human health. So if we keep seeing all these changes, then we'll probably be seeing more cases of cholera, especially in low and middle income countries where poverty is right from poor infrastructure.
Yeah, I agree with poverty infrastructure, poverty rather, is one of the major factors, and of course Nigeria still has very shocking figures with regards to open defecation and some of all of that. So as much as climate change is a factor, we, locally have major issues that need to be fixed, but let's quickly talk about, addressing the current challenge. How was it managed in the past, and how do you think in 2024, Lagos State in particular, and of course every other, place that may be affected, can quickly address this current, challenge and stop the spread?
All right, so there are a myriad of things that have to be done. Of course, one of them is, in fact, the surveillance mechanism. And we're already talking about emergency operating centers. Nigerian CDC is already actively working with states across most of the states affected, over 30 of them in one form or the other. They're already showing signals of that. And then the issue is that the major ones are basically to be able to ensure that this surveillance granulates to the population level, social mobilization, and then for those who are already at risk, identifying rapidly what cases are there and then treating them, and which includes things that basically are cholera solution, because cholera in itself is easily treatable. I need to emphasize that it's easily treatable. The problem is the window for treatment, and that's because the person gets rapidly dehydrated, and that's the main killer in cholera. So annually, we have over somewhere in the region of almost 40 million cases globally. And out of these cases, you have about 140,000, somewhere between 20 and 140,000, that of these cases die. So it's significant, a significant killer. So that window of management that is very key. And there's also, in fact, there's also oral forms of cholera viral vaccine, which can be given. So basically, these are the main issues: making sure that the surveillance systems are good to quickly detect early and be able to contain it, and then for treatment for those who already have it. And usually what you do with diagnostics is basically most of them at clinical level, you can tell by index of suspicion cases of cholera, and then of course you can also do culture of these two and see the organism, and then for confirmation, really, usually we'll do some form. For confirmation is either culture or form of what you call a genetic system, marker system, which is the polymerase chain reaction.
Okay.
And then the other thing, beyond clinical, you can also diagnose with Well, you can also do rapid diagnostic tests, which are easily available in our immediate environment like that.
All right.
So these are the main things. Yes, sorry.
I wanted you to quickly talk to us about how we can, I mean, first of all, do you think that this is more aggressive than the different cholera outbreaks that we've had? Because there have been reports of people dying in 24 hours. Also, how would you say that we should be able to, what are the things that Nigerians need to know to be able to ensure that they manage this outbreak and, you know, come out of it alive as much as they can?
Okay, so I was going to come to the other part, the people side of it, which is social mobilization, and the government needs to rapidly build up the cholera literacy of people, you know, across the country, so that people are aware when they see symptoms of people who are stooling, and they are uncontrollably stooling, you know, so they see these symptoms in people, you know, and they know these people are at risk of it, and especially in areas where they already identified that, you know, and people are getting rapidly dehydrated and all that, you know. So, and also people have to learn back to this issue of basic hygiene, water, hand washing, and hygiene, personal hygiene, and all that. These are very key. And then the other side of it is the issue of our immediate environment in terms of sanitation, to encourage people to be more conscious of these issues around sanitation, you know, and all that. And they should be more conscious also of the source of water which they take, you know, and especially people who are even traveling, you know, especially that's very important. You don't know where the water sources are coming from and this thing. And of course, you know, so these are very important that people should be aware, some form of these things. So, but it is no more aggressive than previous one. There's no evidence that the current one, the severity is more than previous ones. 01, which is the main type in circulation, is still basically stable type in terms of how its symptoms occur. So there's no evidence that it's actually more severe until proven otherwise. But it's simply probably because of the result of the way things are in the country. One, people are poorer, the economy is very bad, so people's response time or health-seeking behavior time going to the appropriate places for treatment will be shorter, especially if they are poor because they don't have money. So those things may be a critical factor in terms of people's outcomes, in terms of how they are able to take care and be able to be better for it, you know. So we have a multi-dimensional poverty state. So when you throw cholera in that mix, you like throwing a spanner in the works. So it can do a lot of things, and so that's what we're seeing.
Yeah. All right, quickly, let's look at the broader picture. We have a new health minister, Ali Pate. In the last 1 year, would you say that you've seen improvements in Nigeria's health sector? I know that they had an opportunity to state what they've achieved, you know, after 1 year of the current administration. But from what you've observed, you know, is there a lot that the health sector has achieved lately that you can say that, you know, we will be able to have, you know, less chances of seeing cholera outbreaks and other health crises in the future?
Okay, let me state that 1 year to turn around Nigeria health system where we can see cholera outbreaks in the future is too short and too very unrealistic.
Absolutely, I agree with that. I agree with that. You know, but you know, you should be able to tell, you know, from the teething stages that, you know, it seems to be moving somewhere.
Yes. Most of what you're seeing are programmatic investments. Let me put it that way. So I think health is a long-term issue, and some of the things I expect to see are some of the things that he has started working with his team towards making sure that primary healthcare is revamped, because revamping primary healthcare is the cornerstone of the health system. And majorly, most of our primary healthcare facilities at the point, only about 25% of them were actually working out of about 30,000, which is a major challenge for us as a team. And Obasanjo should be able to work out of Water Farm within 10 minutes, be able to get a primary health care center that can serve him. You know, so that's the kind of health system we should have. You know, so that is where we should be at. So if we are not there, we are not there. So any other thing is just celebration in a different space. But to say it, I know Patty, and he's somebody who is committed to doing the right things, and his own vision is to use a sector-wide approach to be able to harness the resources, to be able to revamp Nigeria's health system, especially primary healthcare as the bedrock. So they are working on it from evidence and from the statements they've made, but I think it's too early to begin to think who is here for us. No, it's not. And it's very far. And also, in fact, I feel sorry for the stewards of Nigeria health system, because the work to be done here is enormous, of years of neglect, years of poor performance of the health system, years of inverted investments where we put money in the wrong places in the health system, years of hemorrhage within the health system. Yeah. We just need to come together from a multi-sectoral level. All people are put to make sure our health system is stabilized, because it's the center of our lives. If we don't get health right, we don't get that in people, and we continue suffering. And now that poverty, like I said, is rife within the country, all the recent problems that we're having, it's
Dr. Francis. We really. Yeah, I mean, a good thing that you mentioned, and it's some of the things that you've also spoken about, that it's not just investment in health. There's also, poverty that needs to be addressed. There's basic infrastructure across the country that needs to be addressed. I mean, if you can't keep investing in healthcare when you still have water puddles, and places for mosquitoes to breed in large numbers. So there's many factors that need to come to place.
We still have problem with access to clean, potable water. And the likes. Exactly. So but it's just a lot.
We will expand this conversation at a later time. Let's continue to follow the developments in Lagos State with the cholera outbreak, and we would love to speak with you again. Thank you very much for joining us this morning, Dr. Francis Ohanyido, for your time.
Thank you.